Hello, my name is Carl Cooper, and I'm the Project Manager for the National Disability Navigator Resource Collaborative at the American Association on Health and Disability. And this is our presentation, Health Insurance Jeopardy! Part 5, Summary of Benefits and Coverage. For those of you who are unfamiliar with the National Disability Navigator Resource Collaborative, or NDNRC, it's the mission of the NDNRC to provide cross-disability information and support to navigators and other enrollment specialists, thereby ensuring people with disabilities receive accurate information when selecting and enrolling in insurance through the Affordable Care Act marketplaces. I always say when a consumer is looking at plans on the ACA marketplace, it is like playing a game of Health Insurance Jeopardy! And I say that because those of you who are familiar with the game show know that in Jeopardy! It's not about the answer, it's about asking the right question. And consumers need to make sure they're asking the right questions about the plans being offered in order to make an informed choice. So let's play our game. Today we're looking at the category Summary of Benefits and Coverage. So we'll start out, the individual that you're meeting with wants to know if the plan will cover a specialist that he sees. In this instance, you need to ask the question, does the Summary of Benefits and Coverage say whether or not the plan uses a network of providers? The Summary of Benefits and Coverage will make it clear if the plan uses a network, and if it does use a network, you're going to want to make sure you're checking the physician directory to see if this particular specialist that the individual sees is on that directory, because if they're not, then they might want to consider another plan. Moving on, if the individual has a condition that requires that she take a specific drug, then you need to ask the question, does the Summary of Benefits and Coverage say what drugs are covered and what the drug copays are? And this is important because drugs will be dealt with on the Summary of Benefits and Coverage in specifically saying what copays are and specifically how they're handled with respect to certain tiers. We talk a lot about tiering in the other video that deals specifically with prescription meds, and there's a link below in the description if you want to access that video. But for purposes here, all you need to know is the Summary of Benefits and Coverage will say how these drugs are handled, and this is going to be where you're going to want to check out to find that information. The next, if the individual that you're meeting with uses rehabilitation therapy, you're going to want to ask the question, does the Summary of Benefits and Coverage say what the cost will be for rehabilitation therapies and if there are any limitations? Once again, if you want to learn more about rehabilitation therapies, you can check the video out that we have on that specific category, and there's a link below in the description that you can get that information specifically about rehab. But for purposes, once again, here, all you need to know is the Summary of Benefits and Coverage is going to answer some of those questions that we address in that specific video. Moving on to the next situation, if the individual you're meeting with is a wheelchair user, you're going to want to know whether the Summary of Benefits and Coverage says what the cost will be for services such as durable medical equipment. Once again, there is a video that deals more with medical devices, and I'd encourage you to check that out if you want to get more information about this. But for purposes of this video, the Summary of Benefits and Coverage is going to be where you're going to get some of the answers to the questions that we deal with in that specific video. It's important to know that on all of these issues, whether it's prescription drugs, rehab therapies, durable medical equipment, or whatever it is the specific need of the individual is, the cost many times is something that's got to really be factored in to get an accurate idea of what the financial burden is going to be for the individual. So if the individual is signing up for the plan, it's going to be more than the premium that's going to be their cost. If there's high copays or deductibles that are related to these specific areas, it could end up being much more cost prohibitive than maybe paying a little more for a premium and paying less for some of these other costs on an ongoing basis, so that ultimately their costs are less over the course of the year. Now, what happens if the Summary of Benefits and Coverage is unclear about the coverage of or limitations on durable medical equipment, or really any of the areas that we're dealing with? This could become a problem. In this instance, you have to ask, where can you get the answers on this coverage when they're not covered in the Summary of Benefits and Coverage? And we have a series of fact sheets that deal with all these issues in much greater detail, and I would encourage you to go to our website and check those out. They deal with the Summary of Benefits and Coverage. There's another document that you can look at to find some of these answers, which is the Evidence of Coverage document that's available from the insurance company. And then ultimately, you might end up having to contact customer service, and we have a fact sheet that deals with that in terms of getting some of these answers. I like to point out my own personal story when it comes to this area because it's important for you to realize the importance of these issues. Specifically, in my situation, I use a wheelchair, and I looked at the coverage available on the Maryland Exchange where I live on some of the plans that were offered to see how durable medical equipment was handled. And I have to say, as someone who knew what questions to ask, I still had a hard time getting answers to these questions. That's why it's imperative that you're making sure that the people you're dealing with are asking the right questions in the first place, because if they're new to insurance, they may not even know what questions they should be asking. And it's your position as an assister or navigator to make sure that they're asking the right questions so that they can make an informed choice about what is going to be the best plan for them. If you are interested in finding out more about the NDNRC or want to access those fact sheets I talked about earlier, you can check out our website, which is www.nationaldisabilitynavigator.org. You can also find my contact info on this slide. You can feel free to reach out to us if you have questions as you're assisting an individual with a disability enroll in health insurance. Also, please subscribe to our YouTube channel to get more helpful videos like this one. And if you're interested in learning more about the other categories listed, as I mentioned in the video, be sure to check the links out in the description below to access those videos. Thank you.